Thank you to the organisers of this virtual conference for enabling us to present this paper. This presentation discusses risk factors for facial lesions in piglets and teat injuries in sows. Piglet face and sow teat or udder injuries is a pig welfare issue seen during the farrowing and lactation period. Teeth reduction is commonly used to reduce the incidence of piglet face and sow udder injuries during this time. Since the main solution to these injuries has been to reduce the teeth, research is lacking on other alternatives. However, teeth reduction is a painful procedure, and it only masks the issue rather than treating the root cause. And there's also a lack of understanding of current practice, with anecdotal evidence that many farms have solved the underlying or root causes leading to the need to reduce teeth and no longer perform this procedure. Or they have simply had to manage without teeth reduction, as this is part of a labelling scheme and is not permitted. This project has two parts. Firstly, a literature review on the risk factors associated with injuries to the piglets' faces and the sows' udders, to identify the root causes behind the need to reduce teeth. And secondly, a pork producer survey to identify what is currently happening on farm in relation to teeth reduction and other procedures to manage the issues of piglet face and sow udder injuries. Google Scholar was used for the literature search, and for this presentation I will record the results from the peer-reviewed scientific literature. Several search terms were used to capture all the literature relating to sow, udder and piglet face injuries, encompassing different terms used for all the injuries and the potential risk factors associated with these injuries. The search terms are shown in this table. For the producer survey, we designed an online questionnaire in Google Forms in several different languages, and then a different survey software was used in China. The questionnaire had 20 questions in 4 separate categories. The first category on general management included questions on the practice of teeth reduction, so whether or not they perform teeth reduction, whether they clip or grind the teeth, how often they perform it, and at what age. The second section on general management included the farrowing system used, the floor type in the farrowing system, any training of staff, any management strategies they use, like cross-fostering, nurse sows, or supplementary milk, the litter size they have on their farm, and whether they use any environmental enrichment or nest building material. The third section discusses problems and solutions, so the rationale or why they perform teeth reduction, the severity of the issues of teat and face lesions, and the suspected reasons for these injuries. Then any solutions they have tried and whether or not they worked. The final section includes demographic information, so the size of the sow herd and their respondents' role on the farm, their age and their gender. This table shows the results of the literature review, including the different risk factors along the top, and then whether the study recorded sow teat lesions, piglet face lesions, or both. So most of the scientific studies actually compared whether or not piglets had their teeth reduced. And teeth reduction, it was clear, did reduce the prevalence of piglet face injuries, but it was actually inconclusive for the sow teat lesions. Unsurprisingly, large litter sizes increased the risk of both types of lesions. That was clear. For the other risk factors, there were far fewer studies, and the results are less clear, but I will talk about some of them now. So research into the farrowing system is lacking, but there are early indications from the research that is available showing that loose systems reduce the risk of lesions. And loose systems are more comfortable for the sow. They allow her to farrow in any position she likes and also move around in lactation, which might improve milk production and also could reduce the risk of lesions. And loose systems are actually often linked to schemes where teeth reduction is also not permitted. So the farms learn how to manage the issues without teeth reduction. And the section on environment includes studies on the use of enrichment and on the type of flooring. Early indications also show that enrichment might help reduce these lesions, but research is lacking, and the studies on flooring were very diverse with different types of flooring and also not too clear. So the sow factors included parity and the use of nurse sow strategies. And higher parity sows are at greater risk of lesions, and also sows with intact litters, so not used as nurse sows or not cross-fostered onto, tended to have fewer udder injuries. The piglet factors included cross-fostering status, piglet size, and nutritional supplements. And early indications are that excessive cross-fostering may increase the risk of piglet face lesions, and actually access to supplementary milk may reduce these injuries. But again, there's not a great deal of research and the results are less clear. And when we get to the full paper, we will include all the different literature types other than scientific literature. So just to summarise what the scientific literature is telling us so far, it is clear that teeth reduction does reduce piglet face, but not sow udder injuries. And one study even speculated that infection that enters the dental pulp due to damage caused by teeth reduction could actually then enter the udder and cause infection there. It's also clear that large litters increase the risk of both lesion types. And this is not surprising, as piglets must compete to gain access to the udder, and sows may not have enough milk to feed a large litter of growing piglets. The other risk factors were less clear, but the use of enrichment and loose farrowing or lactation systems have the potential to reduce the risk of both lesion types. And also, increased knowledge on the impacts of managing these large litters using cross-fostering, split suckling, and also nurse sows have the potential to decrease the risk of both types of lesions. So far, we've had 40 responses to the English version of the survey, and we are yet to pull out and translate the other results from the different languages. And we have had 26 respondents who said they don't reduce the teeth, and 14 who said they do reduce the teeth, and from a wide variety of different countries shown here. 4 of the respondents reported using teeth clipping, 9 used grinding, and 1 used both, and that was possibly due to staff preference for either technique. 11, so most of the respondents that do teeth clip, use the procedure when the piglets are less than 48 hours old, and then the final 3 respondents said they do it at 3 to 7 days old. 7 respondents reported reducing all the litters and all piglets, and 3 reported reducing the teeth of all the litters but not the small piglets within the litter. 1 reported reducing the teeth of most litters but not small piglets, and then finally 3 reported reducing the teeth of most litters and all piglets in that litter. As expected, when asked why they do have or think teeth reduction is used, 27 selected piglet face lesions, 22 selected sow udder injuries, and 12 mentioned it was standard procedure. 4 used it for ease of management, and 2 due to insufficient milk production. When asked to describe the severity of face and udder injuries on their farm, the majority reported having never seen these issues or mentioned that they were manageable without changing the management. However, around a third of respondents mentioned that they needed to adjust management practices to manage these issues, and 1 unfortunately mentioned these lesions are simply not manageable. Respondents were also asked what they think are the main reasons for the occurrence of piglet face and sow udder lesions, and this plot shows what they selected from most frequently selected at the bottom to least at the top. As expected, poor milk production, not using teeth reduction, and large litters were selected most often. However, a lack of enrichment and excessive cross-fostering were also selected by several respondents. The respondents were also asked to indicate what measures they have tried to solve the issues of piglet face and sow udder injuries and indicate whether they worked. And this plot shows the measures selected with the proportion of respondents who selected the measure worked, did not work, or whether they have tried it. The highest proportion indicating the measure worked are towards the left, and the lowest proportion that worked on the right. And the numbers above the bars indicate how many respondents selected each measure. Avoiding large litters had the highest proportion of respondents selecting that this measure worked, followed closely by mothering traits in the sow. Teeth reduction alone was third, along with the use of nurse sows. Other measures impacting sow milk production, so improving sow nutrition and increasing water intake, were selected by a high proportion of respondents as also having worked. And other measures show potential, including frequent checks, early piglet nutrition, and the use of enrichment. Compared with the use of nurse sows, other measures to manage the large litters, like frequent cross-fostering, split suckling, and artificial rearing, were selected by fewer respondents as having worked. So what does this tell us? Well, interim results of the survey indicate that teeth reduction is not the most important solution, as many farms are managing the issues of piglet face and sow udder injuries by managing large litters, including the use of nurse sows, and enabling adequate milk production using sow and piglet nutrition, encouraging water intake, and performing regular checks to enable early intervention if a problem is seen. And we hope that the final survey results will indicate the best combination of management techniques and possibly indicate any gaps where research could assist in finding optimal solutions. So as mentioned, litter size, milk production are important risk factors to minimise the issues of piglet face and sow udder injuries. Teeth reduction may actually mask the issue rather than dealing with the underlying causes. Further investigation could assess the costs and benefits, both in terms of economics and pig welfare, to help producers decide the solutions that could work best on their farms. And novel research approaches could consider combinations of management techniques shown by the survey results to minimise piglet face and sow udder injuries to indicate the best use of management intervention. And finally, we'd like to thank World Animal Protection for providing the registration fee to attend this virtual conference, all those who assisted with the questionnaire design, the translation, and also the distribution. And last but not least, thank you to all those who completed the questionnaire, whose responses are valuable to solving this welfare issue. And of course, thank you all for listening.